Back pain was something that used to be experienced by elderly and adolescent people, but nowadays it has become a thing among kids as well. Hello friends, I am physiotherapist Meghana, and in today's video we are going to talk about back pain among kids. If you have a child who is studying in some higher grades, and even sometimes a smaller kid will also experience back pain. Why do this happen? What can be done to prevent it and how it is diagnosed? We are going to discuss about all of this in today's video. I am your host physiotherapist Meghana, and this is Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of their health. Now, coming to today's topic, back pain among kids. This is a problem which is sometimes just because of postural habits, sometimes following sports or else some athletic activities, and many a times it could be a serious condition which needs proper medical care. Back pain causes can depend or else say vary based on the age duration. For example, a child between age group of 3 to 5 years could experience back pain because of some serious medical issue or else because of fall, compared to a kid who is teenager or else between the age group of 12 to 19 will experience back pain following hormonal changes that happens following puberty, sometimes due to deficiency of certain important nutrients in the body, sometimes due to just poor postural habits leading to muscle weakness, and sometimes following fall that leads to the injury to the back muscles. During teenage time, when a child is reaching puberty, there is a lot of imbalance in the hormonal system that happens, leading to deficiency of some basic nutrients in our body like calcium, potassium, vitamin D and vitamin B12. This all things makes the muscle more weaker, leading to more higher chances of development of muscle strain. Muscle strain is nothing but a pull or else some strenuous activity leading to spasm within the muscle. Common situations when child or else a kid can develop muscle strain is following a poor postural habit. If a child or else kid has this habit of using laptop, phone for longer periods of time, they tend to be in a hunched back position, putting a lot of stress and strain on the back muscles, leading to back pain. Sometimes poor abdominal muscle strength and tight hamstring muscles, also called as back thigh muscles, could lead to experience of low back pain. Carrying heavy backpacks could also lead to experience of low back pain. But the good news is, this kind of problem can be very easily managed just with the help of posture correction, improving the strength of core muscles, and at the same time focusing on good abdominal muscle strength and doing some basic flexibility exercises. Kid can easily recover from the low back pain issue. Coming to the second common reason of back pain in kid is a hunchback posture. Even in my previous video, I have shown that hunched back posture is one of the common reason for back pain in child, and also is a poor postural habit. Day by day, as the use of technology is increasing, kids are more prone to develop hunched back posture. Hunched back posture put a lot of stress on your spine, especially on your pectoral group of muscles, at the same time on your thoracic muscles. This group of muscle leads to a triad of tightness and weakness, which is also called in medical term as upper cross syndrome and lower cross syndrome. These two situations leads to weakness and tightness and experience of low back pain. As I also mentioned that deficiency of nutrients could be a leading cause for back pain in child. The reason why this happens is because of the hormonal imbalance. But what is the implication of this hormonal imbalance and poor deficiency? That is stress fracture. Stress fracture is a fracture that happens in the area of body following the weakness of the bones. Stress fracture of the spine could also be secondary to some medical conditions like infection that's present in the spine, or else sometime an abnormal tumor being present in the spine. Although both of the situations are very rare, but if the back pain persists for a long time, this is a red flag or is a sign of caution for the parents. So if you are a parent of a child who is experiencing back pain, what you need to do? So the first thing is make sure you visit to your doctor as soon as possible. If your child's back pain persists for more than 2 days, which has no leading cause, known cause, then it requires a proper medical diagnosis. Sometimes it could be just a poor postural habit which needs correction in order to reduce the symptom of back pain, and sometimes it requires more higher intervention in the form of physiotherapy, which is a combination of electrotherapy, supportive devices and exercise based on the situation in which the child is having pain. Exercises usually vary from mobility exercises, flexibility exercises and strengthening exercises. This all depends on the situation of back pain in the child. Hence, it's very important after you get a green signal from your doctor, see a physiotherapist and take further physiotherapy help. The third thing is requirement of ruling out of other potential or its probable cause for back pain. For that, some of the diagnostic tests which are commonly prescribed by doctors are X-ray, CT scan, MRI scan, certain regular blood tests like CBC, ESR, etc. Even sometimes if the child is anticipated to be having poor bone strength, bone scans is done in order to identify the bone mineral density of the child. Once the diagnosis is done properly, then is the part of management, which is very customizable and needs to be properly designed with the help of a professional. But moreover all this, the most important thing is prevention. Back pain among kids is very easily preventable until unless it is something of medical cause like tumor or infection. Other mechanical causes can be corrected before it shows some bad side effects. Hence, make sure if your child is adopting a poor postural habit, you correct them as soon as possible. Also make sure that you insist your child be a part of a physical activity that improves the strength of the body. Sometimes kids who are involved in sports-based activity also develop back pain, and that's due to lack of proper warm-up, lack of proper nutrition and sometimes wrong technique. Hence, in those situations, it's very important coaches of the kids understand the value of proper warm-up and make sure that the warm-up is done in a correct way. It's responsibility of parents to make sure that nutrition is provided to the child that helps the child to prevent or else say sustain the injuries that can happen or else the stress that can happen while play. Whenever the child or else kid is involved in athletic or else play-based activity, one thing plays very important role which is mostly ignored is the footwear. Sometimes wearing proper footwear also makes a huge impact in reducing the stress that comes to the back muscles, at the same time back. Hence, it is very important that the child uses a good quality footwear that absorbs the shock very well. Third thing that parents should do is to make sure that they provide proper nutrition in general, whether the child is involved in the day-to-day athletic based activities or not. But nutrition is very important. If you are facing any difficulty in finding out what's the right nutrition portion for the child based on the age, make sure you visit a clinical nutritionist in order to figure out what is the nutritional requirement of the child, and make sure you provide that particular nutrition to the child. In upcoming videos, we would be also talking about some abnormal spinal deformities that could happen following poor postural habits, or sometimes unfortunately kids develop since birth. What are these postural deformities? In order to understand that, make sure you stay tuned with us. So that was it for today's video. I hope you like this information. If yes, make sure you like this video, share it with your friends and family members, and don't forget to subscribe to our channel. See you next week. Thank you.